everyone, my name is Devon Charlier. I'm a research assistant at the Upper Midwest Agricultural Safety and Health Center, or UMASH, and today I'll be sharing a bit about our work assessing occupational risks of manure applicators in our region. I'd love to first just thank our collaborators. Their names are listed at the bottom of this slide, and I'll start by sharing a bit about our Emerging Issues program at UMASH. This program it allows us to identify and be responsive to emerging and re-emerging issues that are impacting the health, safety, and well-being of ag workers and their families in our region. Manure management became a notable emerging issue for us at UMASH for a few reasons. First, the Upper Midwest experienced a number of severe injuries and fatalities in recent years related to manure management, particularly on animal agricultural operations. And the literature also suggests that manure work may present risk to human health and safety, including pathogenic, chemical, and physical exposures that may result in injury or fatality. And you see particularly things like toxic gas inhalation and confined space incidents associated with this work. In terms of the manure management process, we tend to see risks occurring along the path of manure. A simplified version of this process is pictured here. Starting from the animal, a swine barn is shown on the top left. To storage, an example is a manure earthen basin shown on the top right. And there are a lot of methods for application, kind of the final step in the process. And two methods are shown here. On the left is a surface applicator, and the right has an injection system shown. So in response to this emerging issue of manure management, we conducted an exploratory cross-sectional study to better understand the possible risks that this work presents. So we surveyed 162 commercial animal waste technicians in Minnesota about the nature of their manure work, their safety behaviors, health and safety outcomes, as well as other variables like demographics, etc. Today, I'll share a few of our findings. First, we saw that the use of safety equipment like boots and rubber gloves during manure application were pretty common, makes sense. Some participants said that they also used things like ear protection and goggles, and less common equipment or PPE that they told us they used included dust masks, gas monitors, respirator masks, as well as air supply respirators. We also had some descriptive findings to share with you. First, respondents worked long hours. We found that during the busy season for applicators, participants were applying manure for an average of 17 hours per day, as well as doing other work for an average of over 3 hours per day. This finding was supported by a number of qualitative responses indicating concerns about long hours and fatigue. And we've also heard this concern expressed from our partners that work with manure applicators. We also saw that 20% or 33 of our participants reported at least one symptom of gas exposure, like headache, dizziness, nausea, or vomiting while applying manure. And additionally, 9% or 14 of our participants reported injury during manure application. Of those, the injury severity seemed to be mostly minor, but there were also a handful of ER visits and doctor visits required by the injury associated with the manure work. In terms of our comparative analyses, we found that those working with swine manure had a 9.5 times higher odds of reporting symptoms of gas exposure as compared to those who did not work with swine. We also saw that those who entered a confined space ever, once or more, had a 4.4 times greater odds of reporting symptoms of gas exposure as compared to those who did not enter confined spaces ever. In this analysis, we didn't see any other significant associations between our outcomes of interest, symptoms of gas exposure or injuries, with any of our other independent variables like demographics, role on the farm, other animal species, application methods, or safety behaviors in equipment. So just to wrap up, a few key takeaways from our work so far include: one, fatigue and long hours for this population seem to be important concerns. We've heard it from our partners and we see it in the data. Occupational exposure also may be generally of concern for this population, as 9% of the sample reported injuries and 20% reported gas exposure symptoms related to their manure work. We believe ultimately that further research is needed to gain a better understanding of these risks and strategies for how to mitigate and prevent them. So that's it. Feel free to contact me with any questions or insights you may have about this work. My email is on the slide. And I'd like to, again, just give a big thank you to our collaborators on this project, including these folks from the University of Minnesota Extension and my colleagues at UMass. Thank you.